if a child has been discharged, a newborn, and the mother have gone home, at what point should the mother or the parents be worried that their child may be having more than just the physiologic jaundice?
Okay, now...
what are the signs they should be looking out for?
If the child develops jaundice, it is not in the place of the parent to assume it is physiologic. If you notice that your child has jaundice, you need to take that, or you just feel, oh, okay, it looks as if the eyes are not clear, it looks as if that you just have doubts, or you are not comfortable, I would advise you to take that child to the hospital. Don't assume, okay, this is normal, or I have to wait a certain number of days. You know, the problem we have in this environment is that most mothers, even when they notice, usually want to name the child. So they would wait at home till after the naming ceremony before presenting to the hospital, which is actually one of the problems we have. So they don't present early.
Okay, but let's ask this question now. The dangerous sort of jaundice can come up at any time.
Yeah, it can.
Isn't it likely that the child can be treated at the hospital and come back in time for the naming ceremony? How long does it take to treat?
Well, it is actually depending on what is causing the jaundice. Sometimes you do not require more than for 24, 48 hours treatment. Sometimes it may be longer. It just depends on the cause of the jaundice, really.
Now, I want to ask, how is this condition treated?
Jaundice would usually be treated with what we call phototherapy. They're like specialized lamps that absorb light at a particular frequency. They help to absorb the bilirubin, like to break down the bilirubin.
The light does that? It breaks down the bilirubin?
Yeah, but it's not regular light. It's
okay, I was about to ask if we could just put the child under the fluorescent tube.
No. They are specialized lamps. We usually would prefer the blue light because the wavelength is actually better, but we can use whites and green lights to specialized light. Sometimes we may need to do what we call exchange blood transfusions. That is, we need to totally change, take out the child's blood volume and exchange with blood that doesn't contain as much bilirubin. And then we may also give what we call the intravenous immunoglobulins for patients that have hemolytic anemias. Just depends. Then, like I explained earlier, there are some cases you may need to use drugs to treat. But the most common of all this is the phototherapy. That is what you usually start almost all babies on, pending when you know what is causing the jaundice.
Now, let's assume that a child has started to have symptoms other than yellowness of skin, maybe a fever, and the child is now taken to the hospital. Can those things be reverted? Can full recovery be made, or is any damage irreversible?
Okay, now there are like 4 stages when we talk about severe jaundice, and in the acute phase, you can actually have, in the first 2 stages, you can actually have a reversal of every symptom, of every problem. However, by the time you get to the chronic encephalopathy, the last 2 stages, you always, most of the time, is irreversible damage to the brain. So even when the child recovers from the jaundice, the damage to the brain is there.
It's permanent.
Constant, yeah.
So, pointers. Once the child's skin is yellow, it doesn't matter how faint, parents should take the child to the hospital.
Yeah.
So does that mean that the doctors actually check the child and make sure there's no yellowness before discharging the baby, after the child has been born?
No, it is not done routinely. It just, like I said, that everybody is treated is individualized.
Okay.
If you have there are risk factors for a baby to develop jaundice, then that child will be checked and then referred. If the child is jaundice, referred to a jaundice clinic. If there are no risk factors, this child, and the child is healthy, the child may be discharged, can be discharged home, and the parents advised on, okay, you need to look out and this and that. So not all babies will get a jaundice screening done at birth.
Before they leave the hospital. No, and they are not also given a follow-up visit that will make the doctor quite sure that, you know, there's no jaundice, like come in 2 days or something like that.
Almost every baby will get a follow-up visit. Every baby needs to get a follow-up visit.
So that's covered then. How long, just, as an aside, how long does it actually take an infant's liver to fully develop?
Roughly about from the second week of life, you have most of the enzymes beginning to function maximally, so the jaundice begins to drop. Well,
Okay.
so about
Are
the
there
second week
any
of life.
things that mothers should absolutely not feed the child, maybe in the first weeks of life, to not get this kind of condition after
Actually,
they've left the hospital?
ideally, exclusive breastfeeding is what we teach and we advocate for. So you
Most
shouldn't.
mothers give water and sugar.
They are not supposed to give water and sugar. Those things can actually worsen the jaundice. They would not cause jaundice, but they can worsen it, the jaundice, because there's what we call the breastfeeding jaundice.
Oh, can you take us through that, breastfeeding jaundice?
Okay.
What's that?
This usually occurs when the child is not getting adequate nutrition, and it's common. Funny enough,
From the breast milk?
yes, from the breast milk. It's common because it's common in breastfed babies, because initially most mothers would not be lactating properly, and the babies may not actually latch properly.
Okay.
So the baby may not be getting adequate nutrition, and this would sort of like slow down the transit time for the milk, for the food to go through the intestine.
Okay, so what you're saying is, as long as the baby is feeding well on the breast milk,
Yeah.
there should be less of this problem.
Yes, the baby, in fact, if a baby has jaundice, you should feed more. Feed that baby properly.
On breast milk.
Yeah, feed that baby properly.
Okay, what does bottle feeding the child do to this condition?
Bottle feeding with what? With breast milk?
Formula.
Formula. If by the time you're feeding the child with the formula, that means you're actually either doing mixed feeding, or you are not feeding. You are not giving breast milk, and breast milk, like we said, is still the best for the baby. So formula in itself is not going to cause jaundice. In fact, there are some formulas that contain some proteins that actually help to excrete bilirubin. So it's not like formulas will cause breastfeeding, but we advocate for exclusive breastfeeding because that is actually the best for the babies, and it helps the baby and the mother to bond properly when the baby is sucking directly, and then helps to nourish the child too.
Okay. I noticed that babies who are treated for jaundice usually have their eyes covered. Okay. Now, the reason why I want to ask this question is because it's easy enough to tell the mom, please just make sure these eyes are covered. But the child usually wants to yank off the cover on the eye. It's like a game with them. They just keep drawing the thing down. Does that light cause any harm to the eyes of the baby? What really is coming from that light? Is it bad for the baby's eyes?
Actually, studies haven't proven that the light is actually bad for the eyes, but it's actually uncomfortable staring at light. In adults, it has been shown, blue light, which usually has been shown to cause some degree of damage, but studies have not proven that in children. So we do that covering is more of a prophylactic thing to cover the child's eyes. Then apart from that, you kind of protect the skin around the eye, because jaundice has an effect, a transient acute effect on the skin around just on the baby's skin.
Okay, that was just so that we would know why we're covering these eyes.
Yes.
So it's just like a precautionary measure,
Yes.
and because it's been linked to other harmful causes in adults.
In adults, yes, not in children, not in babies.
So, just before we close, what would be your last word to parents, caregivers, parents now, because they're the ones who take the newborns home, about jaundice?
Okay, I would like to say that once you notice jaundice, yellowish discoloration of the eyes of your babies or the skin, take to a hospital. Then there are so many myths surrounding jaundice. If you put on a yellow cloth or you eat yellow fruits or foods, it has no effect on the skin of the baby or on jaundice. It doesn't cause jaundice in the baby, so you are allowed to eat whatever you want to eat. It doesn't affect the baby's health it doesn't cause jaundice in itself. Then also, very, very importantly, because G6PD is the commonest cause of jaundice in our own environment, and this has been linked to the use of naphthalene balls, so that is camphor. A lot of mothers use camphor to store baby's clothes. Then we use mentholatum and rub on the baby's cord and all that. All that
such practices should be stopped.
Yes, yes, because you do not know initially who has G6PD deficiency or not. So most of the time you have some of these mothers are the ones that precipitate. When they get home, you've discharged the baby's present to you, you find out that she has been using camphor balls to store the baby's clothes. Then also, mothers should not be quick to give it like routine, that you find out that every child that has jaundice, or in fact, the child doesn't even have to have jaundice, the mothers just start giving antibiotics. Everybody gives, you just find out that she says, oh, but they were discharged on antibiotics, or she was giving, this is actually a word to both the health workers and the mothers. Do not administer drugs. Some of the drugs, there are some drugs that also precipitate hemolysis in babies that have G6PD deficiencies. So you may actually be causing harm to your baby and not helping your baby.
Thank you so much, Doctor. I'm going to have to stop you there. Thanks so much for coming and sharing those myths. That's really going to help some mothers. And you out there, thank you so much for being with us. We are so glad to have you every week. Have a great day. I'm Mary Alale Yusuf.